Welcome to the Deep Dive, where we take a stack of dense sources and distill them into the most potent nuggets of knowledge.
Glad to be here.
Today, we're moving far past general fitness advice and into the really specialized, intricate world of how we instruct movement, especially when the body is compromised.
A really critical topic.
It is. I mean, if you're an instructor or even just someone who loves movement, you know the standard training. Matwork, Reformer, all those foundational principles, they give you a spectacular base.
They absolutely do.
Yeah.
They teach you the rules of the game, so to speak.
The rules, exactly. Alignment, basic progression. But the thing is, if you look at the source material, those courses are really designed for, well, what you might call a standard low-risk client.
Generally healthy bodies.
Generally healthy bodies. But the problem is, that's just not the reality of the studio floor, is it?
Not even close.
The minute you open your doors, your clients are bringing in these really complex medical histories.
Oh, everything.
Chronic low back pain, hip replacements from 10 years ago, people who are post-op.
Ankle instabilities, scoliosis, prenatal clients. The list is endless.
Right. These bodies are not standard. They're complex, adaptive systems that are actively dealing with an injury or a condition.
And that's exactly why we need this deep dive today. Our mission is to unpack this essential specialization that addresses that very complexity. It's often called injury special population or ISP training.
Okay, ISP.
And, this is so critical because that basic knowledge, while it's necessary, it's just not sufficient anymore. Not if you want to guarantee safety and really optimize the outcome for these clients.
So it's about shifting from just following a script to truly adapting.
Precisely. It's becoming foundational.
Okay, let's unpack that transformation. If the goal is to shift from teaching, generic fitness exercises to providing true functional adaptation, what specific knowledge gap does ISP actually fill? Is this like moving instruction into the field of musculoskeletal rehab?
In many ways, yes. That's a great way to put it. What's so fascinating here is that ISP provides the fineness, the detail that foundational training has to, by necessity, just skip over.
That fine print.
The fine print, exactly.
Yeah.
Standard courses teach you the what of the movement. ISP forces you to dive really deep into the why and the how of the adaptation for that specific person. This involves three really critical areas. First, you get a detailed understanding of the biomechanics of the lesion itself.
So what's actually wrong?
What tissue is truly compromised? Second, you learn the phases of tissue healing. Is this new inflammation or is it old scar tissue? They need totally different approaches.
And the third?
And third, you establish a clear hierarchy of contraindications, especially when pain is actively present. What do you absolutely not do?
Let's make this tangible. Give us a concrete scenario where a basic instruction, something well-intentioned, could actually cause harm.
Okay, a perfect example is the client with chronic low back pain. The lumbalgia client, as we see in the sources. They come in, they're tight, they're stiff. A standard instructor, thinking I need to improve their mobility, might prescribe an aggressive spinal flexion exercise.
Like a roll down or something.
A roll down or even a poorly cued chest lift. Now here's the danger. If that instructor hasn't learned to assess for things like segmental stability or these micro instabilities.
Tiny little shifts in the vertebrae.
Exactly. Tiny shifts. The flexion might look like mobility work on the outside, but what they're actually doing is placing shearing forces on already compromised structures. They're encouraging the big global muscles to fire even harder while completely failing to recruit the deep stabilizers.
Like the multifidus and transverse abdominis?
The ones that actually provide the stability. So you're perpetuating the pain cycle because the movement is just poorly controlled at that micro level.
Wow. So the ISP training gives them this sort of X-ray vision to avoid that trap?
Precisely. It forces the instructor to shift from just teaching the exercise to performing what you could call a clinical reading.
A clinical reading, I like that.
Yeah, they have to constantly assess what is the tissue status right now. Does this movement require more passive stability or more active control?
What can this body handle today?
What stimulus can I apply today without overwhelming its ability to adapt? It transforms the session from, a choreography into this meticulous, individualized refinement.
That need for analytical depth brings us right to the mechanics of stability. That deep dive requires a technical framework, and our sources highlight one that is absolutely central to ISP training. It's the dialogue between form closure and force closure. And this is a really critical technical nugget for you, the listener, to grasp.
It is. If we connect this to the bigger picture, stability is not just about having strong abs. That's such an oversimplification. It's an intelligent interaction. Let's look at form closure first. Form closure is the passive stability. It's provided purely by the body structure. So the shape of the joints, the interlock of the bones, and the tension of ligaments and capsules.
So it's the architecture of the body.
It's the architecture. Think of it like a perfectly designed archway or a truss bridge. The structure itself provides resistance to collapse. The best example is the pelvis.
Okay.
The sacrum fits into the ilia like a keystone. The shape of that pelvic ring, plus those super strong sacroiliac ligaments, creates a passive mechanical lock. That lock, that structural support, that a form closure.
That makes perfect sense. The frame of the house is built strong. Now, how does force closure step in?
So force closure is the active dynamic stability. This is generated by the muscular system, the fascia, and maybe most importantly, the nervous system's precise recruitment pattern.
Muscles that turn on.
The muscles that turn on to compress and stabilize the joint. We're talking about the transverse abdominis, the pelvic floor, the multifidus, the hip rotators, the deep system. The key realization in ISP is that injury often compromises one or both of these closures, and you have to know which one.
I see.
So for example, if a client has severe sacroiliac instability, their form closure might be compromised because of ligament laxity.
The passive lock is weak.
It's weak. So if you put them into a challenging asymmetrical movement, you're stressing a structure that already can't hold its own passively.
So your job changes instantly. You can't just cue them to lift heavier or hold longer.
You absolutely can't. Your job is to consciously use force closure to compensate for that compromised structure.
To build that active support where the passive support is lacking.
Precisely. And this completely changes your cueing during an exercise like a basic bridge. Instead of just squeeze your butt, you might cue deep, conscious abdominal engagement and focused breathing before they even start the lift. You're ensuring that muscle corset stabilizes the pelvis first. You learn to manipulate everything, load, springs, gravity, to give the client only the challenge they can handle by actively recruiting that force closure.
That immediate shift from just mechanical instruction to focusing on neural control is really powerful. And our source material makes it clear that injury involves more than just a damaged tissue. It causes the nervous system to learn avoidance and protection.
Absolutely. The nervous system becomes hypervigilant. After an injury, the system learns to overprotect. And that has these profound impacts. You see local muscle inhibitions.
So muscles that just won't fire.
They just won't fire correctly no matter how much you tell them to.
Yeah.
You see major compensatory patterns and, critically, avoidance behaviors. The client develops a genuine fear of movement.
They anticipate the pain.
They anticipate pain, and they often hold a lot of anxiety around it. So in ISP, the focus shifts entirely to re-educating the whole motor network. We are, in a sense, teaching the brain that movement is safe again.
How do you do that?
Through sensory feedback, hyperconscious slowness, and meticulous attention to breath, you are reprogramming the motor map by giving the brain perfect, non-threatening information. You're moving beyond just strengthening an isolated muscle. You're cueing the nervous system to coordinate the whole system again.
So the goal shifts from lift your leg higher to something like breathe, observe your hip joint, let the movement float out from the center without bracing.
That's it, exactly. It's subtle, but it's huge. It's the difference between instruction and neuroeducation. And that expansion of the role, as you hinted at earlier, brings us right to the ethical boundary.
Exactly. I was going to ask, if an instructor is analyzing tissue status, observing these compensatory patterns, talking about nerve inhibition, how do they ensure they don't overstep that line? What's the clear demarcation between this kind of analysis and a clinical diagnosis?
This is a point that training addresses with the utmost seriousness. It's so important. ISP provides an expanded paramedical culture. It does not, under any circumstances, permit instructors to establish a medical diagnosis or substitute for a physician or a physical therapist. We are not diagnosticians, period.
So what does that culture provide then?
Our expanded culture simply allows us to understand the language of injury. It helps us know when to refer out. It helps us read a report from a physical therapist and then adjust our session accordingly. It also reinforces professionalism by teaching instructors how to create comprehensive functional reports that use proper technical language.
So you can actually talk to the other professionals.
You can have a seamless collaboration.
That creates a smooth handoff then between all the professionals. So the client gets coordinated care instead of mixed messages from two different worlds.
Exactly. The ISP-trained instructor becomes this precious informed link in the client's whole adaptation chain.
Okay, let's shift focus now to the practical gains. For an instructor who gets this training, how does this level of precision change their day-to-day practice? even with a client who just wants general fitness.
They gain two major superpowers, I would say: precision through functional analysis and a mastery of modulation.
Okay, tell me about precision.
Precision means you stop seeing the client as just someone with back pain, and you start seeing their specific compensatory strategy. You notice how they stand, where their weight settles on their foot. You notice if they're a belly breather or a chest breather, which muscles have just vanished from the movement conversation. You're conducting an analysis based on integrated function.
And modulation.
Modulation is the ability to adjust everything: the load, the speed, the complexity, the plane of movement, instantly, based on the client's response that day.
So you're not just following a plan.
You stop following a predetermined choreography and you start treating the session as a laboratory. The equipment, the springs, the straps, all become tools for finally dosing the resistance needed for optimal tissue adaptation.
Give us a detailed example of that modulation in a complex case, using the equipment as a lab.
Okay, let's take that post-surgical knee patient. An ISP-trained instructor starts by reviewing the medical framework. What procedure was done? What are the doctor's hard contraindications? What pain level is acceptable?
So they're not guessing.
They never guess. Then they apply the integrated model. Initially, they might focus on controlled, closed, kinetic chain loading, usually footwork on the reformer.
And why the reformer?
Because the carriage provides a stable but movable surface, and you can adjust the springs to provide minimal resistance. You can focus only on reestablishing the proper axis hip, knee, ankle without undue stress. You're targeting the medial quad, the deep rotators, and the spring adjustment becomes this meticulous act of dosing the exercise just right.
And then progression is slow from there.
Very slow and deliberate. Maybe moving to single leg loading, then introducing a little instability by changing the surface or spring tension, and finally, much later, moving toward proprioceptive work. You never skip a phase of healing.
We've talked a lot about injury recovery, but what's fascinating is that the training is equally vital for high-level athletes, people who seem perfectly healthy. How is ISP useful as high-level prevention?
It's huge for prevention. High-level athletes, runners, dancers, powerlifters are actually a high-risk population.
Because of the repetition.
Repetition, high-force movements, it all leads to micro-lesions. And they develop these sophisticated compensation strategies to just push through the discomfort. So they're often very strong, but they're not coherent.
Strong but not coherent. I like that.
Yeah, the ISP training helps the instructor look past the obvious strength and locate that hidden fragility. It's about seeking global coherence. For a soccer player, it's analyzing how the lumbopelvic axis responds during a quick lateral cut. For a dancer, how their shoulder integrates with the rib cage during an overhead lift.
You're looking for the weak link in the chain.
The weak link, exactly. By using ISP assessment tools, you can find that tiny stabilizer that never fires, forcing a big superficial muscle to overwork chronically. Addressing that compensation pattern before it becomes chronic tendinopathy or persistent back pain, that is high-level prevention. You're improving efficiency and durability.
That shifts the conversation for the entire movement profession. So, what does this level of specialization mean for the future? Will ISP remain optional, or is it on the path to becoming a necessary standard?
Well, if we connect this to the bigger picture, the demographic trends are pretty clear. Society is aging, and chronic issues related to sedentary work, stress, and old sports injuries are just rising exponentially. The demand from clients for precision and safety will only increase.
So the market is demanding it.
The market and the healthcare community. Our sources suggest that physical therapists, orthopedic surgeons, they will increasingly gravitate toward professionals who can speak this technical language. I think not having ISP training or an equivalent specialization will soon really limit an instructor's scope and credibility. It's moving from a desirable asset to a near mandatory standard of quality.
This deep dive has really shown that ISP is transformative. For the instructor, the central change seems to be transforming doubt into discernment.
That's a great way to put it.
You stop wondering if you're doing the right thing, and you know exactly why you are making a specific pedagogical choice.
And for the client, the deep change is transforming that initial fear of movement that injury causes into rediscovered confidence. It allows them to become an active, informed player in their own recovery.
If you had to summarize the entire spirit of the specialization in just 3 keywords, what would those pillars be?
The 3 pillars of this practice would have to be lucidity, precision, and alliance.
Okay, unpack those.
Lucidity, because it forces you to face the reality of the bodies in front of you and your own professional boundaries. Precision, because every choice, every spring, every cue, every speed adjustment has to be intentional and justified. And finally, alliance, Because meaningful adaptation never happens in isolation. It's an alliance with the client, a seamless alliance with their caregivers, and an internal alliance with your own intention to work with skill, not chance.
That commitment fundamentally changes the scope of the profession. If the body, whether it's dealing with an old injury or striving for high-level performance, is seen as a partner and not an enemy, then this level of specialization is really an ethical commitment to read the body's story with ultimate precision and profound respect. We encourage you to analyze your own practice and consider where this level of adaptation could take your teaching.